Hi, this is Tay with Thinking with Tay, and today we have as our guest Dr. LaCourtney Setzer. How are you, Dr. LaCourtney?
I'm amazing. How are you?
I'm doing great, Dr. LaCourtney. I tell you, it's really interesting, you guys. Just for the listeners, I want to just tell you, I've known Dr. LaCourtney for a number of years. Actually, she was one of my mentees in an organization that I started along with my local sorority. And I mean, she was extremely shy at the time, but it is so good to see her, how she's basically bloomed and manifested into this powerhouse of a doctor now. And I mean, she is really handling her business, and I'm extremely excited to have her as a guest here today. Dr.
Yes, I'm
LaCourtney,
happy to
without
be here.
further ado, I want to share a little bit more about you with the listeners today, just so that they can get to know what you do a little bit better. So, Dr. LaCourtney Setzer is a trauma warrior and couples counseling crusader with a love for serving and helping others. Since the tender age of 4, Dr. LaCourtney has focused on serving others. As an adolescent, she received a Presidential Freedom Scholarship from United States President, wow, George W. Bush for completing 2,000 hours of community service. Wow, that's a lot of work, Courtney.
Yes,
Dr. LaCourtney maintains a master's degree in social work from Appalachian State University and a doctoral degree in social work from Capella University. For 15 years, Dr. LaCourtney has served as a trauma-focused mental health provider, working with diverse groups from children to senior adults. Dr. LaCourtney is passionate about working with individuals to improve their lives, living more abundantly and on their terms. Dr. LaCourtney's clinical practice includes evidence-based interventions and holistic centered practices in African and Indigenous principles. Phenomenal. Dr. LaCourtney has been coupled with her spouse for 16 years. Wow. And maintains a healthy relationship with him. When not working, Dr. LaCourtney enjoys movies weekly. Recently, she was awarded as a recipient of Top 40, under 40 from Livingstone College related to her contribution to healthcare. That is an amazing feat. She raised over 1,000 for Livingstone College and is committed to the work with historically Black colleges and universities. On January 12th, 2023, she was featured as a podcast guest on Dr. Bernessa Roberts' All Things Authentic, featured on Apple and Google Podcasts to discuss her trauma background. Hear ye, Dr. LaCourtney Setzer. Again, we are so happy to have you with us today, Dr. LaCourtney, and I am just extremely impressed with what you've been able to accomplish in your life, in your young life thus far.
Thank you so much. Thank you so much. And again, I'm super excited to talk about mental health in any capacity.
Absolutely, absolutely. So let's just go ahead and jump in. I want to just learn a little bit more about it. I want the listeners to learn a little bit more about, what you do, because it is so very important for us to remove the stigma of mental health and therapy. Because a lot of times people will, oh my gosh, I don't want anybody to know that I actually receive services. So we're here not only just to learn about what you do, but to also remove that stigma of receiving these type of services, because they are beneficial, and mental health is real. So let's get started. Tell me, when did you find that you were interested in becoming a mental health therapist?
So this is a funny story, but I definitely will share it. So I knew I wanted to help people at the tender age of 4, but I didn't really know in what way I wanted to help people. And so
Okay.
initially, I wanted to be a nurse. And then as I grew and grew a little bit more, I noticed that being a nurse had to do a lot with blood, and I realized that was not for me.
We all know.
So I
We
said,
all know. It's not my cup of tea either.
no. So I said, I want to help people in different ways. And so I was introduced and pretty much provided information about other ways to help people. And I really love social work. And so I
Yeah.
started to really kind of grow in social work. But I kept telling myself that I'm not going to be a therapist. I'm not going to do therapy. That's not going to be my thing. Um,
Really?
I did. So as I was growing and as I got my master's in social work, I was looking for like my next step where I wanted to grow and go. And I had a
Okay.
conversation with my mom, which you know my mom very well.
Yes, very well.
And we had a conversation about employment and what social work looks like and things of that nature. And after that conversation I had with her, where she gave me some motivational quotes and motivational ways and really kind of encouraged me, I realized that a therapist is where I should go. And I said, I'm just
Wow.
going to try it for a little while and we'll see where it goes. And here I
Yes. Here
am.
you are and doing excellent at it. Doing excellent
Thank
at
you.
it.
Thank you.
So
But I
tell me
love it.
about, yeah, great. I'm glad you do. Tell me about that educational path for people who don't really understand how you arrived at becoming a therapist. Just kind of share with us those steps, just for people who may aspire to become a mental health therapist.
Great question. So, my biggest thing I would say is being a mental health therapist, there are different pathways to get to that point. And
Okay.
so, some people can have a master's in social work, some people can have a master's in counseling, some people can have a master's in marriage and family therapy.
Mm,
So, they can come from those three different disciplines. There's three different boards that you would go through, but the commonality there is really getting that education, those masters, of course, submitting to the boards of either social work, counseling, or marriage and family therapy, getting those hours really working with people, and then passing that exam, that master's, that clinical exam
yes.
to become
Mm-hmm.
a mental health therapist. So I would say either social work or counseling or marriage and family therapy is the background, but how we get to be a therapist, the commonality is the experience as well as that exam.
Awesome, awesome, awesome. Thank you for sharing that because honestly, I knew that there were different ways in order to get there, but I know that the path isn't always clear. So,
Mhm.
but thank you for sharing that. That is so important. So tell me about your center, and if you'll pronounce it for me, because I don't want to butcher it. So, will you just share the name of your center and just tell us a little bit about how you are servicing your clients through your center?
Great question. So the center is a Shea Healing Center. And the reason why it's called that is because a Shea is an African way of saying, like we say amen. It's like an
Yes,
African way of saying that. And
yes.
so I knew in order for me to really kind of like hone myself and really find my niche, I needed to tap into that because that is a part of me and my
Who
culture.
we are.
And so
Absolutely.
Shea Healing Center, LLC, Dolores Place is there. And so it is a virtual center that allows us to work with children, allows us to work with adults, it allows us to work with couples, and really kind of use evidence based interventions to really help them to be a better version of themselves in any way they can. But I do want
Excellent.
to take a chance to talk about who Dolores is.
Yes,
So,
I do want you
Dolores
to.
Dolores is my middle name, but also
Yes.
Dolores is the name of my grandmother, my maternal grandmother. Her name
Awesome.
was Beatrice Dolores Johnson Colbert, and she
Yes.
was a trailblazer in Catawba County. She really
Okay.
helped, as well as my grandmother did, Georgianne.
Oh,
So
yes.
they really helped to build the community. They really, because Georgianne was really more of a midwife, and then Beatrice was more of helping as well. And so she
Awesome.
really, every person she worked with, she built them up. She gave them those motivational quotes and really helped them to be a better version of themselves. And I said that is pretty much the lineage of where I come from. And so if I'm going to work with people, I'm going to take that along with me, and I'm also going to honor her. So that is why it's named Dolores Place.
Oh my goodness, I love that. I knew there was a nod to that and really the respect because you come from really great legacy. So, and and I know you stand on strong shoulders, so in order to do the work that you're doing, you're drawing all of that energy of your ancestors into this business, hence the name, Ashe. I mean, and it is beautiful tribute to your grandmothers. I mean, that is phenomenal and just awesome in itself. So the work that you're doing, it's tied to not only yourself, but to them. So that is
Exactly.
beautiful. That is beautiful. And so you did share a little bit about the services. Is there a particular target population that you focus? I know you said children and adults, but it's what particular, I'll say, and is it the African American population or just in general at large? What is your focus or target population?
Great question. So with Ashe Healing Center, we are more of a group practice. And
Okay.
so because of that, we have a lot of different therapists that work with us and different counselors that work with us where they have different niches and they have different ways that they build into it. So I would like to say our target person is everyone because
I
each of
love
us
it.
have a way that we can serve. We have some therapists who love children. We have some
Yeah.
therapists who love adults, some that love couples, and then some that love group therapy with substance abuse. So I would say our target person is everybody. We're here to help everyone.
Here to help everybody heal. I
Mm-hmm.
tell you, and that's interesting because it's more like a holistic approach that your center offers. So you stream, there may be, just like in law, right? There's practice areas that we all, or I'll say attorneys know about specifically and what they practice in primarily. So I can appreciate the fact that your center offers all different backgrounds and disciplines with respect to mental health because everybody can win, everybody can learn, everybody can heal by coming through your center. Excellent, excellent. So tell me, from your perspective, what is mental health and mental health therapy?
Great question there. Mental health is the way that we think, act, and feel about ourselves and the world around us. It's the teachings that we got from growing up as kids as well as into adulthood, and it frames the way that we see the world. So that's
Mm,
what mental health is. Mental health therapy is really kind of learning those coping strategies and skills to change the way that we think and feel and act in this world that we are living in. So I would
yes.
say that's the difference between the two of them.
Mm-hmm.
But I think the biggest thing I also want to mention is a big part of mental health and mental health therapy is trauma, because trauma also shapes the way that we think and feel and act. And trauma is any distressing event that's happened either in our childhood or adulthood that has really kind of left a bad taste in our mouth. And it kind of
Mm.
lingers and continues with us, and it's a big part of our mental health.
Yes, yes. And that's something you raised a very fine point there. We all have, and I've read a lot of different books about the power of like even the subconscious mind. There are many books about how, our precedents, our experiences, the things that we've had in our childhood can affect us in our adulthood. Some things we're conscious of, some things we're not conscious of. And there may be triggers later on in life that may cause like trauma. Well, it could have been trauma then, we just didn't recognize it. And then now we're like, oh my gosh, something may have reminded us about it, what happened, or something happened similarly to it. And then at that time, we're like, oh my God, what is this? Why am I having this nervous breakdown? Why am I crying? So that's something that was a point that you raised there. You're right, because sometimes we're not dealing with these things, and sometimes we're not even conscious of it.
That's very true. That's very true. And I think for us as Black people being disenfranchised, I think a lot of times because it's happened to us and it's happened to our lineage so much, there it goes back to what you were saying. There were things that have happened in our life that we don't see as traumatic anymore. It's just life.
It's just life. And we've learned, the sad thing about it, Dr. Courtney, is the fact that we've learned to live with the abnormalcies of life. Some things we
Yes,
don't even recognize that are abnormal, and things that we really should not be living with, right? And
exactly.
what we might consider as being, it's just that. That's just how, it is, but we don't realize the impact that it is having on our bodies until sometimes it might be too late. So that's
That's very
why
true.
the Shea Healing Center, I mean, is certainly something, a place where people can come to and unpack some of those things that they really weren't conscious of until something happened that reminded them of such. Wow,
Exactly.
wow, wow. Very, very good. So let me just ask you, and I know you're a mental health therapist, and this is really your opinion. So tell me, what's the difference? Because I've heard there's several different disciplines. What's the difference between a mental health therapist, a psychologist, and a psychiatrist? Can you share? I mean, I understand definitively what that means, textbook. But
Mhm.
what is really the difference, and how are they serving, individuals, I guess, together or individually, separately?
I love that question's there, and I want to talk a little bit more of it, but it also kind of keeps me in the mind of Don King. Can't we all get along? And we can't.
Can we
We
all
can
get
all
along?
get along, a minute.
That's right,
Because
because it's
some
kind of
people
like,
think,
wait a minute,
yeah. So I think we can all get along. I think we
okay,
can, but
okay.
I think the biggest thing is that there's different disciplines and there's different ways that we see the issue. I would say that's the biggest way to kind of see the difference between all of them.
Okay.
With psychiatry, it's more of seeing it as a medical issue to treat and heal. For
Mm.
psychology, it's more of taking the way of psychology, like the degree of psychology, and seeing it in that framework. And
Yes.
that's more of just seeing it as an issue and how do we looking at the patterns and things of that, and how do we change that? And for mental
Hmm.
health therapy, it's using a different discipline, whether it's social work or whether it's marriage and family, like therapy background of seeing how to work the issue. So each of them can work together. Mental health therapy is more of introducing different strategies and skills to really help that person to have a better frame of life. Psychologist is taking those coping strategies and things of that nature and possibly putting them into like a psychiatric kind of evaluation or things of that nature. Psychiatrist is more of looking at the issue medically and treating it with medication. All of them can
Okay.
coexist together. All of them bring different ways of seeing the issue, but that is the difference between all of them.
Excellent, excellent. Now, let me ask you, do you find yourself working interdependently with some of these other professionals? Like, say, for instance, yeah, you may identify in therapy that somebody may need medication, but that's not necessarily something that you're in a position to prescribe. Or maybe you are, I don't know. Can you prescribe medication?
Actually, I can't prescribe medication, but I do want to say one of the biggest things that we're doing at a Shea Healing Center is that we have a psychiatrist who will be joining our team in July,
Excellent,
in
excellent.
Virginia. And then, of course, in North Carolina, we're working towards that. And so they will be able to serve when we have those things where we're meeting with people and we're saying to them, hey, it would be good to also kind of continue to get these strategies but also kind of get some medication to help the issue as well. And so thankfully that is something that a Shea Healing Center is growing to get as a psychiatrist in July.
Excellent, honey. You're going to be a one-stop shop, honey.
That's
You
the
don't have to
plan.
refer externally. That is
No.
super smart and a great strategy for business. Let me just tell you. So, excellent, 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 honey. Excellent. So, can you tell me, if someone was to walk into the Ashe Healing Center, what would be the first thing they would do? Of course, you do, and you provide virtual services, but what can they expect? What is your, I'll say, if it's called clinical process, but what is the process? What can they expect as a first timer? for therapy? What are their expectations whenever they, reach out to you to the Ashe Healing Center?
What I would say, and great question there as well, definitely visit our website at www.asehealingcenter.org,
Yes.
o6.org.
Yes.
And definitely click on schedule the appointment. And the
Yes.
first thing they will have is they will have an array of people that they will be able to look at their bios, look at their backgrounds, and see who they can match with.
Excellent. Excellent.
The next thing is once they schedule that appointment, then they will be able to complete some paperwork virtually of just some needed paperwork of just their consent to therapy, kind of getting more information of the practices that we have at Ashe Healing Center. And then the next thing they will do once they have their scheduled appointment is they'll get their video link and they'll meet with that therapist. And that therapist will ask them questions about who they are as a person to really kind of assess how we can better help them. And then the next sessions will be about helping them to build to a better version of what they want. It's not about what we want, it's about what you want and how you want to get there.
Excellent. Excellent. You're considering the person first. You're basically going in. So the expectation is we want to learn a little bit more about you before we start saying, oh, this is what you need to do. And that's really important because, again, the stigma behind, a lot of times with this mental health therapy and going, especially in the African American community, and really at large, some people, can say, oh my gosh, I have a mental issue. It's always this sort of, but truth be told, everybody has some things that they probably could work on in their lives.
Exactly.
There's some
Exactly. We all have
remediation
something.
efforts that really can, really be worked upon on each individual.
Absolutely.
Because again, going back to what we talked about before, sometimes we don't recognize that we have trauma. Sometimes we don't recognize that we have it. And honestly, it may be just a good idea for all of us to just go and tap in and just see if it's something there that we
Exactly.
might need to work on just to better ourselves. We go in and we go to medical doctors every year, or twice a year just to get assessed and make sure we got our checkups. But, for our bodily, concerns, but not necessarily our mental concerns. So I certainly, I'm a proponent for this. I'm learning a lot more about it with
Absolutely.
you. And I mean, certainly the work is necessary for sure, especially with all of the things that are going on in our lives right now. Politics,
Yes.
issues with uh just criminal acts, against persons, and then organizations and establishment and just systemic things, that we all are dealing with in our lives. And while it may not be something that happened in our childhood, it may have been something that happened on the job. It may have been something that, we lost our best friend and we don't really understand what that looks like, feels like. We may have lost a husband, or a mother, and so in those things, and with in handling those things, we might think, oh, it's just normal, it's the cycle of life. And yes, it's the
Mhm.
cycle of life. It doesn't mean that it doesn't impact you though. So wow, wow,
Absolutely.
wow, wow. So tell me, what type of assessments do you use to make a mental health diagnosis, or do you do that in your center?
We do.
Okay.
So the type of assessments that we do is we do something called a biopsychosocial. And what that means is we ask you questions about who you are biologically, we ask you about who you are socially, and we ask you about who you are psychologically. And so providing more information about that, we ask you about, hey, what is your background? Like what is your culture? What is your customs? When you grew up, what did growing up look like for you? And we also
Mm,
ask about who are your supports, who are people that you depend on, who are your friends, who are things of that nature that really are supporting you, maybe in therapy or supporting you in life. And then we also ask more about your medical history, your
mm,
medical diagnosis, your medications, maybe your family history with depression, your family history with anxiety or schizophrenia, or things of that nature, because
yes.
all of that shapes who you are. And so that's
Mm,
what we do a lot of times is we ask the biopsychosocial who you are pretty much overall. Because in social work, that's the biggest thing that we kind of look at. as we look at who you are through all of these different systems
Family,
of
and
who you are.
yes.
Mm-hmm.
Awesome, awesome, awesome. That's excellent because you're right. There could be some experiences, or genetically, right? Medication could cause some things or some interruption in mental health. So you raised some really good points there because that's true. While we might seem or appear to be, again, normal, right? There may be things that, be it medications that we're taking that may cause different things to happen or trigger different things that may have been lying dormant in our bodies. And that's really interesting. I'm glad you raised those points. So that's great in terms of the assessments that you use and, in considering the whole thing. What does your childhood look like? What kind of medications are you on? What's been your bodily health history? That's really interesting that you consider all of that and you just don't jump right into that type of thing. Excellent, excellent. So let me ask you, in your opinion, because again, we're offering this, platform and this discussion as a public service. So we're not asking you, we understand you're an expert in your field, but this is really from your personal experience as a mental health therapist. So what do you consider the major mental health concerns, or what have you found in your experience to be?
Well, I would say pretty much just because I'm one of those people, I think you had mentioned before, a trauma warrior. I would say one of the most common mental health concerns that I see is trauma. And the way that trauma affects us, whether it affects us in a depressive mode, whether it affects us in an anxious mode, whether it affects us in different ways. So I would say the most common mental health concern is trauma. And then pretty much the effects of trauma would be depression, anxiety, bipolar, as well as post-traumatic stress disorder. I would say a lot of those, but I think it all stems from trauma, and us identifying what are traumatic things and how it affects us. So I would say for me, the most common concern would be trauma.
Mm. And that kind of falls into the next question I had in terms of what do you consider as the leading causes? It's really traumatic experiences from different things. You raised PTSD, like maybe post-traumatic stress disorder. That could be, you've heard instances where people have even come out of the services, prisoners of war and different things. And so while there may be, situations that they're dealing with, the things that they saw and the trauma that they experienced while they were there, can really have a long lasting effect upon them. So, wow, 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 wow. Excellent. So let me ask you, I kind of raised this earlier. What do you consider, or do you consider that mental health? It's not always genetic because we talked about the traumatic experiences. But do you find that often times, maybe even some of your clients, or maybe just in your experience, that genetics play a large part in terms of mental health?
Absolutely, absolutely. And I think it's in more of different ways than we see it. I think biologically there are some things, because there are research that shows that depression and anxiety can be genetically passed down. But I also want to take some time to talk about how trauma is passed down as well. And
Please,
I'll give an
yes.
example.
Yes.
If there is, yelling, if that was the way that everybody communicated, if that's the way that mom communicated to dad or dad communicated to the
Mm.
kids, and that was passed down to this child, and that's how they communicate, and then they put it to their kids, and that's how their kids communicate. And so every time you're in that household, everybody yells at each other. That can be traumatic.
Mm.
And so just being aware that, hey, that's hurtful. And so noticing that, hey, I can't, keep a relationship. I can't keep a friendship. I can't keep a job. And I can't keep these things because I yell at people. Why do I yell at people?
Mm.
I yell at people
Wow.
because that's how my family communicates. That's how their family communicated. That's how
Wow.
all their families communicated. And so being aware and being open to saying, okay, I want to stop this pattern. I don't want to
Mm.
continue to bring to my kids communicating in that way, and being open to learning strategies of how to communicate in a more assertive way, or being
Yes.
passive aggressive, if that's how they communicate. I don't want to
Hmm.
communicate passive aggressive to my kids or to
That's
my
right.
husband or wife or things of
That's
that
right.
nature. I want to change it. And so being aware and being willing to say, okay, I need to throw that part away that I learned from
Mhm.
my culture, I learned from my family, and I'm going
That's
to
right.
use this way. And I'm going to encourage others to do that. That's what it's a part of, is really just say. So I would say when you say, is it genetic? Yes, it is. But also
Hmm.
being aware that trauma is genetic. And I have the opportunity to change that pattern, but I have to be open to that.
Excellent. Oh my goodness. I'm glad you went ahead and explained a little bit further how trauma and how that can cause, mental health. And you're right. Sometimes just in growing up, what's normal in our household seems to be normal in life, right? Until you
Yes.
actually experience it differently. And you may go to someone else's home, you're saying, oh, everybody ain't yelling at each other. They're not all
Yeah.
talking at each other. It's like rah, rah, rah. She's not cursing her dad out, or, the mom isn't fighting the dad, in front of us. And it's like, oh my goodness, this is normal too.
Yeah.
And
Exactly.
but you're right. You're absolutely right. It's pattern. It can be,
Yes.
the mental health, because even some people might say, well, that's not a mental health concern. That's just, bad behavior. No, because if you carry it down and pass it along, right?
Mhm.
Wow, I didn't consider it that way, but you're absolutely right. What you were used to growing up in your household, when you start to have kids, if you don't get the help to stop it, first of all, recognizing there's an issue, but then getting the
Exactly.
help that you need to stop that so you don't carry it on from generation to generation to generation.
Mhm.
Excellent point, Dr. LaCourtney. Excellent,
Thank
excellent
you.
point.
Thank you.
So, from your perspective, do you feel that everyone need mental health therapy? We've talked about this a little bit, but do you believe that everybody need that little wellness check, with mental health therapy, in all seriousness?
Yes. I'll say
Okay.
it this way. There's nothing wrong with every one of us at least meeting with a mental health therapist to check in on our lives. I will say it that way. I wouldn't say that every person needs it, but I'm just going to
Okay.
say it doesn't hurt for every person to go and see someone and talk with someone about, hey, what's going on in my life? Just to have that
Yes.
extra support, that third party, someone I don't know who has no, as we say, skin in the game, someone that doesn't have any
Yes.
skin in the game, just saying, hey, this is what's going on in my life and how can I improve and get better. So I would say it definitely wouldn't hurt.
It would not hurt. I agree. I wholeheartedly agree with that. So let me ask you then, what are some of the things we understand genetically, because I've heard about, schizophrenia, sometimes that's passed down and that's through genetics. But is there anything that we can do to sort of mitigate the mental health complications that we have? Even if someone says, I'm scared of therapy, I don't like the stigma that goes to it. What are things that we can do? I imagine it, just from my perspective, I imagine just having a good work-life balance, going out and maybe exercise and getting, reading or what have you. What are some of the things that, in your opinion, you think that we can do to mitigate some of the mental health complications that we suffer from?
That's a really good question too. But I would say one of the biggest ways to do that is to make sure you're keeping up on your medical appointments. You're keeping up with talking with friends, you're talking with family who are supportive and positive. I would say those are
Yes.
ways to mitigate it. But I would say it's about being open and honest about breaking patterns would be another way to
Yes.
mitigate it, saying,
Mm,
"Hey, this is not normal. This is not normal, and I don't want to pass this down. I want to improve. I want to get better. And how do I do
yes.
that?" And so,
Yes.
being open and honest to being able to do that and finding ways to do that, I would say, is a way to mitigate it. But keeping those
Excellent.
appointments, and if I do, if unfortunately, if I do have these things, these mental health issues or illnesses, they're not the end. Like I can have a normal life and
Hmm.
have schizophrenia. I can have a
That's
normal
right.
life and have bipolar, depression, anxiety. But if I take
That's
my
right.
medications and I follow my coping strategies, I can live an okay life and being
Yes.
committed to that.
Yes. Yes. I like that. I love that. Let me ask you too, as well, just along that same line. And we talked about the stigma, behind mental health and why people don't choose to go that route or to receive those type services. Can you help us as a mental health, therapist? Can you help us better understand the need for it and removing that stigma? What are some things that we can do to think about it, mental health or the receiving such thereof? How can we get comfortable with receiving these type services?
Okay. How we can get comfortable with receiving these services is we have to put away those ideas and things that we were taught about mental health and therapy and what it looks like. Mental health
Yes.
can be affordable. Mental health therapists do look like us. There are men and women who are African American descent or other that look like us, and they are
Yes.
willing to help. And they are willing to help in ways that maybe others aren't. And mental health therapy is for everyone. It's not just for, and I'll
Everyone.
be open and honest, not for the white people that we see on TV. It's for everyone, and it's about
Yes.
helping them get a better version of
Yes.
themselves. So being open to knowing these things and putting away those things that we were taught as kids, or we were taught in our communities that, hey, we don't do that. We don't, we're not crazy. We don't go to mental health therapy. That's what they do. So
Yeah.
throwing away those ideas is how we get better, is removing those things and being open to getting better with people that look like us.
Yes, excellent, excellent. Because you're right, a lot of times, and we find that because that's not something, because honestly, and no, and respectfully, I'm going to say this respectfully, a lot of us are used to just going to our church pastors for
That's
counseling, right? And while I do know a very good pastor, one who actually married us, and one I may actually interview later here on Thinking with Tay, who happens to actually be a doctor of psychology, right? And he actually married my husband and I, and he's a very good counselor. He provided great counseling, marital counseling for us before we got married, right?
Mhm.
That was one of his prerequisites before we got married. But a lot of times we're more comfortable going to our pastors. And again, that's no slight to anybody, but in the African American community, that's what we've been taught, to do, or what, we'll just go to the pastor for everything, but they may not have that skill set, the medical, professional, skills and tools to be able to diagnose, to be able to assess, to be able to implement certain strategies. So I think that that's, we not necessarily have to remove, I think we can work in conjunction with mental health therapists and psychologists and psychiatrists. But a lot of times that's the main thing. We'll just go to the pastor for everything.
Mhm.
Can you, I don't want to put you on the spot, but what is your thought
Okay.
behind that? And I believe I would submit, I'm sure that you think that you can work, again, we can all work together, as you said.
Absolutely. Absolutely. So one of the things that I'm happy about at Shea Healing Center is that we actually work with a few churches to
Okay.
offer mental health therapy to their congregation. And
Excellent.
so I would say one of the big ones that we work with, and you may be familiar with this church, Greater Bethel AME, it's in Charlotte.
Yes.
We actually
Yes.
partner with them, and we actually have a
Excellent.
great working relationship where we offer mental health therapy to their congregation.
Awesome.
And that's something that we're super excited about and continue to do. But we are opening up the idea that yes, you can see the pastor, but you also can see mental health therapists as well to help with anxiety and depression and what's going on in your life. So I love the fact that we have that great relationship with the pastor there, Dr. Abdul. We're able
Mm-hmm.
to work with
Mm-hmm.
him, and he's able to provide referrals to us on some congregation members who, hey, could benefit from mental health therapy. So I love the fact that we have that coordination.
Oh, yes, that's a great strategy, one, business wise, but two, the partnership there and the interplay
Yes.
between one another, and really the pastor understanding
Yes.
that there is a need beyond himself. And so that
Absolutely.
is what's really critical, because you can better serve your constituents, your, parishioners in a way that can benefit their lives, especially when you realize, oh, this is beyond me, you
Absolutely.
know? This is beyond me. That's excellent. I love that. I love that partnership. And honestly, that's probably the first time I've actually ever heard that. So, and I'm sure maybe other, mental health therapists do that, but I think that's really, really good. And that helps bridge the gap and help actually create a good marriage between the church, especially with respect to the African American community, and to kind of remove again that stigma of mental health, receiving mental health services. Excellent, excellent, excellent. I love that. So, in terms of, if some people say, well, I'd love to receive some services, but financially, I can't really afford it, or I don't have insurance that covers it. So, how can maybe the Shea Healing Center, or, how would you all approach that situation?
Okay. Well, one of the biggest things that we do is we have some college interns. So, a Shea Healing
Okay.
Center also partners with a lot of historically Black colleges and universities,
Excellent.
as well as some predominantly white institutions as well. And we have
Okay.
interns that we also have with us. And so they
Excellent.
provide telehealth services and they provide it for free. So we do 13
Oh,
free sessions where single parents can receive therapy. And then after those 13 sessions, they receive it at a reduced price. So, one of the biggest things I would say for people who are non insured and they are looking for therapy and they're wanting to connect with us, that we have that ability to do that. If you are a single parent, we can provide that to you for 13 free sessions. So, I would say definitely go to our website to find out more information.
excellent, Dr. LaCourtney. Honey, listen, you are given, they have no excuse, honey, not to receive. Honey, they have no excuse not to receive any services or get the help. There's no
That's right.
reason where, there's no reason that you are sitting here and saying, well, I wish I could and I could. No, you have so many methods in order for them to receive the services. That is excellent. And it's an excellent service that you're offering to the community, and understanding that there are underprivileged communities, and as you said, single mothers who can't afford these type services ordinarily, and that you have systems in place, be it through interns or what have you, and to offer these type services. And this is excellent. I'm thoroughly impressed.
Thank you.
So we're actually drawing to a close, but tell me, is there anything else you'd like to share with us? And of course, you did share your website earlier about how they can reach out to you, but is there anything else that we've missed here today that you would like to just maybe highlight key points in terms of mental health therapy, and the things that we should know, and maybe even signs that we should we would recognize and say, okay, I think I do need to see somebody.
Great question there. So as we mentioned before, at Shea Healing Center, we are a virtual center. We are committed to working with people to help them to heal from trauma, to help them to heal their relationships, and to help heal their children as well. We are licensed to work with North Carolinians, South Carolinians, Virginians, in Maryland, Georgia, Texas, Washington State, Kentucky, and Texas. I mentioned Texas already.
Yes,
Washington,
let's see.
D.C., as well as Hawaii. So we are definitely growing and getting better. So being aware that we can provide that, a way again to know, hey, do I need to talk with someone? Is, hey, if I'm getting to a point where there are distressing events that have happened in my childhood or adulthood or happening now that are lingering with me, and they are making it hard for me to keep a relationship. They are making it hard for me to keep a friendship. They're making it hard for me to keep a job. I might need to see and talk to somebody about that. If I'm experiencing low energy all the time, I'm feeling low about myself, or I'm super anxious, like I'm super thinking of all my thoughts are going a mile a minute, and I can't get to the
Yes,
point where I can steady those thoughts. It's okay. I
yes.
might need to talk with someone, and we're here to help here at a Shea Healing Center.
Excellent, excellent. Thank you so much, Dr. LaCourtney, for being here with us today and sharing with our listeners, all of the, fine services that a Shea Healing, is offering to the public. I wish, and I'm telling you, I wish you nothing but the best. You know, you're providing excellent work in this community and at large. You know, you're have licensed practitioners basically and all over this country right now, and you're building beyond. And
Yes.
the ability in offering the services to people virtually, you know, gone long goes the time where you have to come in and sit on the couch, right? You can just
Exactly.
do it right here, just as you and I are speaking right now. And that's excellent because there's a reach beyond the couch, right? There's a reach,
Yes.
and you be able to touch somebody in a way that can impact their lives. And that's what you're doing. You're doing excellent work. Extremely proud of you. Extremely proud of you.
Thank
And
you.
thank you so much for being here with us today.
You're so welcome. Thank you again for allowing me to talk more about mental health. I could talk all day about it, but thank you so much.
I certainly see the passion. And to the listeners, thank you so much for stopping by to be with us here today. Dr. LaCourtney has provided just some phenomenal information about mental health, removing the stigma. You know, go out, seek the help that you need. We all recognize when certain things aren't wrong. Sometimes it may not be very blatant to us, but if you're feeling some of the things that she described here today, you know, consider a Shea Healing Center. Reach out to her first, right? Stop by her center, go to her website, and see if those services can benefit you. I'm most certainly that they will. But thank you so much. And remember, I'm not telling you what to think, I'm only asking you to think. So until next time, goodbye.